Are you trying to conceive but diagnosed with tubal blockage? Do you know Ayurveda has also mentioned the best treatment for tubal blockage? Namaste, I am Dr. Chanchal from Asha Ayurveda and today we will be discussing the Ayurvedic perspective about tubal blockage. How we can treat tubal blockage, how Ayurveda looks into the tubal blockage, what is the treatment that Ayurveda provides about tubal blockage. So all the basic questions which arise in your mind about tubal blockage, we are going to answer these questions today in this video. So stay tuned with us up to the end. So what is tubal blockage? Let's understand in a diagrammatic way. So if we go through the structure of uterus, that is a female reproductive organ, there is a uterine body. Along with the two fallopian tubes with the fimbria at the tubal end, and there is an ovary. So this is a basic fallopian tube. So how does fallopian tube works? So basically when a male and female make relation or cohabit, at that time male sperm enters the uterine cavity and it is released like this, and oocyte from the female ovary enters the tube if tubes are open, and there this fertilization process occurs and we say that the fertilization has occurred. So if there is any sort of blockage in this passage, let's understand here. So if there is any sort of blockage in this passage, then it is known as the fallopian tube blockage. Like blockage can be at this end, it can be at any part of the tube, or the blockage can be there because of any sort of fluid inside the cavity. So if there is fluid inside the cavity, we know it as Hydrosalpinx. If there is blockage at this end, we know it as a Cornual blockage. If there is a blockage at Fimbrial end, we know it as a Fimbrial end blockage. So as per Ayurveda, this uterine cavity has this Artavah. Artav means female egg. Vah means it is a passage to carry this egg, and Strotas is a channel. So tubes can be correlated to Artavah mentioned in the Samhitas. So as you came to know that Ayurveda has mentioned about Artavah or fallopian tube blockage thousands of years ago. So has Ayurveda given some solution about these tubal blockages? So next question arises from here. What are the basic causes of tubal blockage and how can we treat these tubal blockage issues? First of all, let's understand the basic reasons for tubal blockage. Common reasons for tubal blockage are: first, PID, which is also known as pelvic inflammatory disease. So because of any sort of infections in the uterine cavity or in pelvic area, your tubes may be inflamed, or there may be some adhesions inside the tube which may create blockage. Second, tuberculosis. If you are having a history of tuberculosis in intestinal area or genital tuberculosis, that is in reproductive system, then this may create adhesions inside the tubes or calcifications inside the tubes and create blockage. Tubal blockage created by tuberculosis is the most difficult and dangerous reason, because it is very difficult to treat the tubes which are being infected and damaged because of tuberculosis. Third, ectopic pregnancy. If you have suffered an ectopic pregnancy earlier, because of the heavy bleeding in one tube which was ruptured earlier, there may be few clots inside the other tube and this can create blockage. So after ectopic pregnancy, one tube may be blocked because of the surgery procedure, or if you have taken conservative management also, then also your tube can be blocked. But other tube which was not infected, that should also be checked for tubal blockage, because there may be any inflammation, any swelling, any adhesions or any synechia inside the tubes. which the other tube which you are having for the safer side. Fourth and major reason is endometriosis. Endometriosis is nowadays a very big disease, and in endometriosis a tissue like endometrium grows outside the uterine cavity at various places. If this tissue grows inside the tube, then your tube can be blocked. If this tissue bleeds during the menstrual cycle in that area, then you can also have Hydrosalpinx. So this is a major reason of tubal blockage. If you are suffering from endometriosis, you should get your tubes checked for blockage at the earliest, so that in primary stages you can get it treated. Fifth, previous surgeries. Any of the previous surgery that you have undergone because of any reasons like appendix, because of any DNC, or because of any previous cesarean section also, sometimes there may be adhesions which have blocked your tubes. So previous surgeries are also a reason of tubal blockage, and most important, congenital tubal defects can also be there. That is a major reason in tubal blockage, because by birth some persons may have single tube, that is a unicornate uterus, and some people may have rudimentary horns. So tube is not developed by birth because of any sort of Mullerian defect. So these are the basic causes of tubal blockage as per the modern science. So how Ayurveda looks into the matter? As per Ayurveda, if your Vata dosha is aggravated, in that case your tubes may be shrunken, your tubes may be firm structured, or this can create blockage. If you have Pitta aggravation, there may be inflammation in your tubes, there may be swelling in your tubes, there may be pus in your tubes, or there may be Hydrosalpinx in your tubes also. These are the basic symptoms which are seen along with the inflammation or Shot or Shov. So these are the words which have been mentioned in Ayurveda Samhitas. Most important, Strotavrodh because of Kapha dosha. So if Kapha is more aggravated in your body, there may be channel blockage because of Kapha accumulation, because Ama gets accumulated in the tissues of your tubes and in the channels, that is fallopian tubal passage, and this will create blockage in your tubes. So Ayurveda has its own perspectives related to the modern science which describes the basic reasons of tubal blockage.